Congress has approved more than a dozen separate measures to take excessive regulations off the books. This includes measures that save jobs in coal country, protect retirement savings, cuts costs for small businesses. After years of sluggish, pathetic economic growth, this is one way we are working to boost our economy and create jobs. Of course, it's not just Congress taking action. The Trump administration has initiated a review of a number of major regulations that are strangling job creation. It has been estimated that so far these changes, just this year, have saved families and businesses more than $63 billion. Think about that. That is a big, broad number, but what it comes down to is this. After years of talk about cutting red tape, it is now actually happening. We are reversing the Obama administration's most recent and last regulatory onslaught. And more fundamentally, we are returning power from unelected bureaucrats in Washington to the states and the people that we represent. For example, one of the rules that we have overturned is called BLM Planning 2.0 rule. That sounds pretty innocuous and anodyne to some of us. But for the people in Liz Cheney's state, in Wyoming, and all around the West, it was a huge power grab that would have hurt jobs and local industry. It was imposed with little input from the states and with no input from landowners. And it was another example of a distant, arrogant bureaucracy that simply just was not listening to the people. Ending the culture of overregulation, it's going to take more than a few months, but we have made a good start. And this is something we're going to keep tackling so that we can help this economy create more good-paying jobs.
As the Speaker talked about, the President yesterday signed 4 more Congressional Review Act bills. These are bills that Congress has passed through. The House has already passed 15 of these pieces of legislation that are focused on creating jobs and saving taxpayers money. And as we look at the bills that have already been signed by President Trump just in these last few weeks, the estimates are that it's saved taxpayers and small businesses over $60 billion, not to mention creating tens of thousands of jobs. And that doesn't even touch some of the things that President Trump has done administratively, like greenlighting the Keystone Pipeline. That alone creating thousands of jobs and bringing billions of new investment into the United States of America. So we're going to continue working to make sure that we are getting more bills to the President's desk that create jobs, that removes the red tape that's costing jobs and forcing jobs to go overseas. And in the meantime, our members continue to work hard to come to a consensus on making sure we can get a health care bill to the President's desk. Obviously, we're not there yet, but we're continuing to work, and there's a lot of really good work being done by our members with all of us together so that we can continue moving this process forward.
We promised the American people an aggressive agenda, and we're continuing to deliver on that. We are focused on the issues, on the most important issues that are on people's minds. And you've heard about the work that we've done already, lifting the regulatory burden that has impacted so many in this country. We've also passed several bills, healthcare related, that are going to improve choices, create more affordable plans for people. We're also working on cutting the red tape that gets in between the veteran and the care that they need every day. And we're not going to stop. Americans need a simpler tax code, and they want health care that's going to mean a better health care for them, no matter where they live. With all of these efforts, I'm also excited to be joining some colleagues of mine that we've worked on in the past on legislation dealing with the ABLE Act. And several years ago, I joined with Andrew Crenshaw, Senator Casey, Pete Sessions, and others, and was very proud to get the ABLE Act signed into law, which is creating tax-free savings accounts for those with disabilities. I remain committed to ensuring that those with disabilities have the opportunity to reach for the stars. That's what we want for all of our kids. And this week, we will be releasing a package of bills, ABLE 2.0, that focuses on building on the successes of 529 ABLE accounts. Will allow individual disabilities to work and be able to put their earnings into an ABLE account. It allows for those that maybe have a 529 college account to actually roll that over into an ABLE account. It increases the age limit from 25 to 45. Bottom line, it means that all people and all walks of life will have policies that will empower them, not limit them. And that's what a government of the people, by the people, and for the people does.
I'm Liz Cheney from Wyoming, and among many of the damaging legacies of the Obama administration has been the absolute strangling effect of overregulation. We've certainly seen it in my state, regulations that were imposed not simply because they were necessary for safety or for health, but really in some instances, in particular in the energy industry, regulations that have absolutely been aimed at killing things like our coal industry, like our fossil fuel industry. The Speaker mentioned Planning 2.0, which was one of the regulations we were able to reverse through the Congressional Review Act, and a whole range of regulations that deal with things like veterans' Second Amendment rights, like our energy industry, have been accomplishments. We've been able here in the House to pass 15 of them. We've had 12 of them that the President has signed into law. And we're going to continue to work to lift this burden off of our economy, to lift the burden certainly off of small businesses and off of industries all across the country, and certainly in my home state of Wyoming. So I'm grateful to be here and excited to be here when we're actually getting things done. Thank you.
Questions? Scotty, you got one?
Anna Egerton from Bloomberg. There's been some talk about changes to the health care bill that would include removing essential health benefits, or at least giving the states the option to have the waiver, which had been mentioned before, but also changes to the community rating system. I was wondering if that would be acceptable to you, and if you think that would win net votes.
Well, like I said, these are ongoing talks that we're having. We want our members to talk with each other about how we can improve the bill to get consensus. Those productive talks are happening. We're at the concept stages right now. The Vice President has been instrumental in bringing together different groups from our conference to talk about concepts. So right now we're just at that conceptual stage about how to move forward in a way that can get everybody to 216. It's important that we don't just win the votes of one caucus or one group, but that we get the votes and the consensus of 216 of our members, and that's kind of where we are right now. So it's premature to say where we are, what we're on, because we're at that conceptual stage right now.
Any concern about protection for pre-existing conditions? Because there's some concern with
No,
community ratings that were addressed.
I won't get into the details of these things other than to say that this is all about getting to the conceptual stage. We don't have a bill text or an agreement yet, but this is the kind of conversations we want. The authorizers, all the various caucus members, the administration, those productive conversations are happening right now, and we're all just talking about conceptual levels about how to improve the ability to get lower. It's all about getting premiums down. This is all about making more affordable premiums, and we have other members who've brought some really constructive ideas to the table, like Gary Palmer and Dave Schweikert, which all revolve around making sure that there are solid protections for people, but getting everybody lower premiums. Manny.
Thank you, Mr. Speaker. Last week, you said that when Chairman Nunes briefed you about the information that he got, that it was a whistleblower who gave him the information. Then it was revealed that at least 2 White House officials helped him get this information. What gives you confidence that it was a whistleblower and that Mr. Chairman Nunes...
Yeah, I don't know who it was, but I'll just say this. Chairman Nunes has my confidence. I've met with the committee. They have my confidence. It's what's important is that this committee does its investigation on a bipartisan basis to get to the bottom of things and go to investigate all things Russia. That's what this committee is going to do. It's going to take some time. It's not going to be played out in a 24-hour news cycle. It's going to be following the facts wherever those facts go, and then giving us a real account, all things Russia-related, to the American people.
You believe it's a whistleblower?
Casey.
Just to follow up on health care, it doesn't sound like you think it's realistic that there could be a vote in the House by the end of the...
I don't know the answer to that question, because I don't want to put some kind of an artificial deadline, because we're at that conceptual stage. We have very productive conversations occurring among our members, but those are productive conversations. That doesn't mean that we have language and text that's ready to go and the votes are lined up. But that's what you need to do in order to get that, meaning get members talking. That's happening. Get everybody engaging with one another. That's happening. Now we're throwing around concepts to improve the bill. That's occurring right now, but that is not to say that we are ready to go, because we want to make sure that when we go, we have the votes to pass this bill. We've got the consensus that we've long been looking for. We're very close on consensus. Like I said, 90% of our conference was already there. 10% was not. And now we're having the kinds of productive conversations among our members, interacting through the committees of jurisdiction and with the administration, and that's just where we are right now.
Last question.
Hey, Andy.
What kind of wins are you going to deliver for conservatives in this big spending bill that you couldn't have gotten last year?
Well, the good news is we don't have to deal with the Obama administration on riders with the Obama administration. We have the Trump administration. And so you know me, Andy, I'm a regular order guy. That means I want the Appropriations Committee to write the Appropriations bill. I want the Appropriations Committee to negotiate a bill. And the good thing is we're working hand in glove with the Trump administration on these things. That's point number one. We don't have to fight an administration that we disagree with on so many issues. We are now working with an administration we agree with. The appropriators are going to go get the best kind of an agreement they can. That's the way the process should work, and I anticipate we'll be moving on that.
Are you going to deliver the wall and this big military?
I'm not going to get ahead of where the appropriators are. The appropriators are the ones who are negotiating and writing this bill, and you'll see it at the end of the month.